Saad, it's so good to have you at our first annual HemOnc Pulse meeting. Appreciate you making the trip from New York. A lot of chatter about MRD in myeloma. It always makes for an amazing session. What were your takeaways, and how are you leveraging MRD in some of the decision making you're doing in myeloma today?
So, I think that first of all, thank you for putting this, group together and having these discussions. I think the key takeaway from the MRD discussion was that still being used prognostically, by the academicians, but the uptake in the community will be really dependent on whether we can use this to escalate or de-escalate therapy, and we're not there yet. I think there was a separate discussion around the regulatory endpoint approval, but it was very clear that it's for accelerated approval, and we still need other survival outcome data to actually demonstrate a new therapy is actually meaningful for patients. But the accelerated approval allows us to get early access to therapies that patients need, and they do not have any other options. The other key takeaway actually was that there is a lot of cohesiveness in our opinions. I thought
there's
I would
actually
see
more agreement than disagreement. I was expecting more like
exactly.
boxing.
So I think it just tells you that when you get a group of people together on a stage, you find that there are a lot more commonalities than disagreements.
No, absolutely. The other thing is, I love the discussion on smoldering myeloma and differentiating that not all smoldering myelomas are alike. I mean, what were your takeaways of that particular discussion?
Yeah, so that's where you'll find a more of a spectrum of opinion. I think for high-risk smoldering myeloma patients, investigation in clinical trials is something that everyone agreed upon. We had people who are comfortable giving single-agent immunomodulatory drugs to certain high-risk smoldering myeloma patients to delay to active myeloma. Others, kind of like me, would prefer putting patients on clinical trials and have that discussion with the patient about the data, but it's not something that I'm as comfortable with. And then you had people on the other side with thinking that we shouldn't even be talking about treating those patients. But the key thing that towards the end of that discussion was, yes, there are going to be patients who are at high risk of developing active myeloma where we'll have to intervene.
Well, thank you so much, my friend, for coming. Looking forward to having you next year.
I look forward to it.
Excellent.